Multiple personality disorder, DID. The facts. The first real cause of multiple personality disorder was recorded back in the year 1865. Psychiatrists and psychologists are of the view that this disorder was present long before its discovery. However, until 1865, these instances were mainly termed as incidents of demon possessions. After the disorder's formal discovery, further research into it was carried out by various neurologists, psychologists, and psychiatrists. Although this disorder captured the public's popular imagination at that time, the concept was vehemently rejected by renowned psychologists like Freud and some other behaviorists because of its rarity of occurrence. It was not until 1980 that the American Psychiatrists Association recognized this disorder as a real mental illness, included it in their diagnostic statistical manual. So what exactly is multiple personality disorder? Now commonly known as dissociative identity disorder, DID. It is important to note that many of us have experienced some instances of dissociation in this form of daydreaming or simply by getting lost in the whim of moment at some point of our lives. That is something nearly all human beings experience and is termed as completely normal. Dissociative identity disorder develops when this dissociation forms reality takes on a severe form. This severe dissociation creates a lack of real connection in the affected person's memories, thoughts, actions, and feelings. The one main cause of this dissociation, as seen in real-life cases, is that of trauma. Victims who have gone through several sexual, emotional, and physical abuse, particularly in their childhood, seem to be more prone to this rare but real emotional catastrophe. The dissociation from one's own real identity is the victim's coping mechanism to literally separate or dissociate himself from the experiences or situations that are too violent, painful, or traumatic for him or for her to handle. In this way, the causes of DID are very much similar to the causes of post-traumatic stress disorder. Recent studies have compelled psychologists and researchers to consider DID as a severe subtype of PTSD, dissociative identity disorder. The symptoms of DID are too obvious to miss. People who are living with multiple personalities may be constantly depressed and even suicidal, while a large part of the affected often report auditory and visual hallucinations. The presence of two or more identities in one single person is the main symptom of this condition. The split or distinct identities have a shifting power over the patient's behavior. The patient is also often unable to recall key personal information that is too absurd to be explained by simple forgetfulness. There are also sudden and highly distinctive variations in memory. The different identities are so different and distinct that they have their own specific race, age, and gender. With a switch of each identity, the victim may take on a completely different posture, way of talking, and gestures. The switching can occur in days or might be as quick to occur as in seconds or minutes. Some other general symptoms of DID include mood swings, insomnia, sleepwalking, panic attacks, phobias and anxieties, drug abuse, time loss, out-of-body instances, self-persecution, self-mutilation, violation, and eating disorders, dissociative identity disorder. It is a fact that although this disorder is real, its occurrence is extremely rare. Currently, the most famous case which has been reported is that of Kim Noble, who is still living with more than 100 personalities inside of her. Now, 53-year-old Kim was extremely distinct identities living inside her. Her most dominant personality is that of Patricia, but there are many more alter egos that are living inside her head, among which are bulimic teenager Judy, gay Ken, and a devout Catholic named Salamo. Her past involves being extremely traumatized at the hands acquaintances, and friends while being ignored by her parents who were themselves trapped in an unhappy marriage. She protected herself by creating a myriad of different personalities which have no memory of the abuse that she went through. In 1995, Kim was officially diagnosed with DID. Her therapy was begun, which she is still undergoing to date. The therapist has to treat each of the patient's identity individually by helping them come in terms with the patient's past. It is true that there has been a lot of research into DID. However, given the lack of real-life cases for enough research, there are several myths that are also revolving around this disorder. One of such myths include the wrong notion that the patient's DID might never fully recover. Although full recovery is difficult, this disorder is definitely manageable like all other psychological disorders. And the real-life case of Jim Noble is a perfect manifestation of the belief. The treatment might take a long time and require intense commitment from the patient and the therapist both. Yet, it is completely possible for a person with DID to live a fulfilling, normal life. The real-life cases of DID, like that of Kim Noble and Chris Sizemore, who spent 45 years in treatment, reveal some very fascinating insights into the psychological anomaly. It raises extremely thought-provoking inquiries into the human unconscious mind and the interrelationship between what can be remembered and forgotten after a traumatic experience. Some people might even term the development of this disorder as fake. However, it is a fact that these people with DID are definitely suffering and need help.